And then they come to support group and they lean in and whisper to me about sex they're like, I know this isn't a breastfeeding question, but it
But
comes
it's
up all the
related.
time. It is. And when you're breastfeeding, your libido changes. A there's a hard chemical, there's the chemistry you can't argue with. So what you do with it, everyone's really different how they feel, but there is a chemical component to being able to keep a milk supply and being able to release milk and what that does to your cravings for sex.
Welcome back to part two of the Pelvic Pulse podcast with Lizzy Gibbs. I'm so happy to be doing this again with you. I've
I'm
never done
excited.
like back to back part twos before, so this is really, really fun. And just for backstory, if you haven't listened to part one yet, go back and listen to it. It's episode 76. And Lizzy just breaks down all the beautiful basics of our bodies and breastfeeding and boundaries that maybe you haven't considered before. And we, got to talking after we were recording and just texting about all the other things we could have touched on. I ended up getting some responses and questions from our listeners and our friends who want to dive in a little deeper. So maybe just to get us rolling, I'll ask some of these questions. And then, of course, if we want to go deeper into some of these other pieces of, um, yeah, just these really interesting topics about our arousal and how the boobs work with all of that. I just think
Yes.
that'd be so fascinating. I have more follow-up questions. So thank you for being here, number
Thank
one.
you for having me. It was really fun to do that before. I would do this all the time
I
if
know,
you'll
right?
have me.
In all the layers. Oh my gosh. It'll be so good. Okay, first question. Thoughts on PT versus OT when your baby has a weak tongue and was born early? So I'm assuming for this gal, her baby's not latching very well. Like, what? I mean, even if there's something beyond PT and OT that new parents can do for their baby who has a weak tongue, what are your
Mhm.
thoughts?
Well, there's a difference between PT and OT, and you can certainly speak to this. PT specializes in, gross motor skills, mobility, strength, and pain management, and in this case, tongue and mouth mobility. But OT concentrates more on like fine motor skills, cognitive and sensory processing. So this would be more appropriate for a preemie baby. When babies are born prematurely, sometimes they don't have one, the stamina, which is a physical thing, and two, the skill. And so OT can be really helpful with that. And it does take time. Development is not something that you can check off by, putting your baby through any kind of like breastfeeding boot camp. So which method to use really depends on the gestational age of the baby. For full term, they might benefit more from physical therapy, but like in this case, prematurity, I would start with OT and then transition into PT for more of a practice. Um, with both of those, something that you could add as an extra benefit is this kind of other funny topic that we've started tapping into, that arousal part, that the yumminess, the tactile exploring of the breast. So anytime we have a baby who's just not quite ready to suck, they maybe have restricted tongue mobility. And that's a topic in itself, by the way, like
Mm,
what's happening with the tongue, that can be a full term or preterm baby, but premature babies who just aren't neurologically ready to feed at the breast yet, it's a lot of work where they're not calorically, you know, ready to burn those calories to get their food and they're kind of trying to reserve every single calorie they get. That's a subject, in itself about tongues, but a preemie baby would really benefit from OT, deciding kind of where that baby's at. And what we do in the NICU as lactation consultants is we also incorporate the skin to skin aspect of it. So regardless of the baby's gestational age, skin to skin is always a really important part of initiating breastfeeding and breast milk.
mm,
Last time we talked about the placenta leaving the body and then there being this really delicate period of asking the body or ordering, asking the body for milk, ordering that milk, and the baby's touch, licking, exploring their tongue, their lips, their smell, whatever's on them right after they come out. It's all feedback being given to your body. So I would start with OT with a premature baby, incorporate PT as they get old enough and you're really neurologically able to use their tongue in that way, and skin to skin as much as possible. Pumping bedside with your baby as much as possible when you have a premature baby. If they're not always on you, like kangaroo care style, where they're touching you as much as possible, putting one hand on them while you're pumping can let your body know, like, hey, my baby's here. This is my oxytocin input.
Mhm.
So I would start with OT in this situation. And don't forget to incorporate the yummy arousal part of breastfeeding, which is smelling, licking, kissing, feeling your baby lick, and even just we call it playing at the breast, dry feedings.
Mm.
In other words, we're not expecting them to get their caloric load from the breast, but rather literally just sleeping with their nose against their mom's nipple, if that's what it is.
Oh
So
my gosh,
cute.
that is
I know.
so cute. I
These
love
teeny
that so
babies, they
much.
really impress me. Some babies are born prematurely and don't need a ton of OT, or they take to the breast, and some babies take quite a while.
Yeah, that makes so much sense. It's like, yeah, that's clicking for me. So thank
Yeah,
you for
PT
that.
is definitely necessary if it's tongue restrictions and they're beyond the point of OT where the baby's, able to suckle at the breast, but we need to practice lateralization of the tongue or elevation or extension, or in some cases intervene with a procedure called frenectomy, where we change the shape of the tongue. And then PT is really good for after that. They
Hmm.
essentially have a new tongue
Hmm.
and they need to learn how to use it.
I wonder if you've heard of or work with anyone who already does it, but the intraoral care for like craniosacral
Mm,
therapy and
hmm.
somato-emotional release for infants. Like that is a specialty within a specialty. And
Yeah.
I think it's such a beautiful
There are some
maybe third option.
chiropractors who do it, and then
Yeah.
craniosacral therapy. I always say try the least invasive
Invasive.
option first. So PT, not super invasive. We kind of see where the kiddo's at and see how they progress. Craniosacral therapy can be really great, especially right after delivery. Now, if your baby's premature and in the NICU, this isn't really an option. But once your baby's home with you and discharged, um, you can have someone come to you, or you can go in office and really have someone help balance out everything that kind of happened in the womb, and possibly upon their exit, if they had a difficult exit, they were stuck in any certain position. um, this can help, really straighten them out, kind of get their jaw, neck, skull, your skull bones are still moving, when you're a baby that age. And craniosacral therapy can help really align everything. And when things are aligned, it is one, less painful for them, but two, easier for them to optimize how they use their mouth.
Hmm.
So I love both of those options. They're not always covered by insurance, so I'm careful not to say, this is required of you and pay X amount of dollars and it'll fix your baby. That's certainly not true in either way.
Yeah.
Um, but yeah, I like both.
I love it. Thank you for that one. All right, let's go to the next question because it's kind of a two-parter, a little uh like what's the word I'm looking for? There's a little extra context. How do I manage going back to work slash bottle feed, but still having her breastfeed when I'm home? And she doesn't want her to stop actually breastfeeding once she's
Mhm.
gone a few hours a day. So how do you keep that milk going when you're starting to pump and bottle feed?
This is a great question because this is our modern world, right? We're expected to go back to work. If we're
Yeah.
lucky enough to stay home, that's really nice. But
Yeah.
if you are going back to work, you are going to keep emptying your breast to keep your milk supply. Supply and demand is how milk supply works. So you're going to remove the milk from the breast at work with a pump as many times a day as your baby's currently eating. If you have a 6 week old, that's going to be more often, more frequently than if you have, let's say, a 6 month old. So you're going to empty the breast as often as the baby would at home. For
Mm,
instance, in the beginning, we're emptying the breast 8 to 12 times in a 24-hour period. So you'd want to pump during the hours that you're away from your baby every 2 to 3 hours. What they get increases really quickly in the beginning. So if you go back to work sooner, you're going to be pumping more often at work. Your baby might have the skill to breastfeed when it's time to breastfeed at home, and then take to the bottle when you're not there. Some babies can start to prefer a bottle because it's nice and easy, and some babies are brilliant and really know the difference. They know who their mom is, they know who a bottle is.
mhm,
So it's possible to do both. She can go back to work, pump while she's there, and then come home and feed her baby at the breast. Babies tend to be better milk removers than pumps, so it's not terribly surprising that when you go and pump at work, you're like, this is all this baby's getting. So what you'll make at the pump really remains a mystery until we kind of try. And that delicate period right after birth, when you're really establishing what you're going to make for your baby in that first 4 weeks, I would say, will help determine your supply going forward. So it's important to get your baby skin to skin and exclusively breastfeed for the first few weeks if you want to establish a pretty good supply based on your baby's needs.
mm.
I think I have another note about this question.
Yeah, I just love the technicality of this all, but it is like just honestly, it's
It's
an
a lot of
experiment,
logistics.
right? There's a lot of
It is a
logistics.
big experiment. Some babies will only breastfeed, and so the mom goes back to work, and I'll get a call on the warm line saying, my baby's so good at breastfeeding, my baby's refusing a bottle.
Mm,
And that's a great reason to reach out to your lactation consultant or come to group and be like, I really want to practice with the bottle. Oh, and we have all the tactics. We can feed them on their side with a paste bottle. We can have somebody else give the bottle. We can change the nipple of the bottle. And as scary as it is for moms to see this, I mean, your baby won't starve themselves if they're really hungry or thirsty. Eventually, they usually take to it, but there are some more stubborn babies. Um, I really press this timeline when I'm seeing patients freshly postpartum is spend the first 3 or 4 weeks not worrying about pump output or what am I going to do when I go back to work. That's stress. That's not good for your milk. And so I say when you're healed and ready for partially healed and ready for the project, the homework of learning how to use a pump, learning how much milk you make, storing your milk correctly, defrosting your milk correctly. It's like there's so much homework that goes into that. I really want people to come back around to that question when it's about to be relevant to them about how much they need. Are they
mm,
working from home? Are they working in an office where they need to leave their baby at a daycare? So it's a really individual equation. And so that's a good time to be like, all right, I saw you 3 months ago. I'm going back to work. This is my pump. Teach me how to use it. And it's a good time to learn about that.
Yeah. Again, what you just said, like everything is so unique, that individual journey with like not just your baby, but with you and your scenario
Yes.
is like pretty wild. I know a little more context for this particular mom, and yeah, it's gonna be interesting. I mean, there's also just the whole. It's making me think about the homework of figuring out if your baby is also allergic to something that you're eating.
Yeah. This is hard.
And when you've been pumping and like creating a supply, or like maybe you're oversupplied in some stages, right? And you've
Mhm.
now realized though that all of that milk was when you were eating XYZ and your baby is allergic to that. It's like,
I
oh,
just shed a tear. If I
I
have to dump
know.
milk out, I just cry. Like whoever it is. I'm like, yesterday, someone filled a 3 millimeter syringe and it was left out overnight, and I like really had a hard time throwing it away. It's
Oh
like
my
drops.
gosh. That's so sad.
That's really hard. Allergies are a hot topic. You've been eating what you've been eating through, and maybe this isn't a question that needs to be addressed, but in the short, to answer it quickly, they've been eating what you've been eating in womb, and it usually takes a few weeks for an allergy like that to show up, and it feels like big and surprising and scary. And you can work with your pediatrician, describe what kind of stools they're having, the kind of behaviors they're having, and most important thing I want to tell people is eliminate one thing at a time. If you eliminate, oh, I cut out eggs and dairy and gluten and I cut out everything and then it resolved and you're like, well, first of all, where are you getting your calories? You got to eat something. But also we'll never know what this kid's sensitive to. So,
Totally, totally. It's got to be
because
the
man, pouring
elimination
out
part.
milk,
I
that's a
know.
topic I don't want to talk about.
That's fair. Moving on. How do we incorporate our partner in feedings with breast milk in bottles?
Well, they're incorporated in the support of, if we have a supportive partner, that is going to help us with our breastfeeding success. Um, so to incorporate them in feedings, there's a few ways to go about it. Some of this will depend on when you want to start this introduction. So if you're starting it right away, you're like, this is our plan. Our baby gets a bottle a night from day one. That's what we're doing. Then I would choose the middle of the night when you usually feel like you're about to crack. You're like, I really need to sleep from 2 to 4 a.m. To incorporate that, you can use a bottle. You can do a finger feed, which is where you put like a little straw on the tip of your pinky and let your partner give your baby that to suckle on so that they can, not get too accustomed to the bottle. You can feed them with a tiny syringe in the beginning, and it just gets dropped into their mouth, little spoon, little cup. There's so many ways to do this in the beginning and keep breastfeeding skill the goal. Bottle is just fine too. You're like, this goes down in a few minutes, like we're all going back to bed and the baby's fed, which is rule number one. If you're starting it
Mhm.
a little bit later, I usually let dad give the first bottle, period, because the baby knows your smell, the sound of you, the taste of you. It's a whole thing. And we're also usually pretty tense as the mom. And of course, I'm using really gendered language. I just want to say that. So as the feeder, you're pretty tense watching your baby like refuse this bottle, and you're like giving tips on how to give it. So I would give it in another. Let your partner do it in another room. Introduce the volume based on your baby's age, and you can get that from a support group or from your lactation consultant. And if you are going to do a bottle. Hold them and cuddle them in your arms. Let dad hold baby at like a 45-degree angle. Gaze into your baby's eyes and fill the nipple that they're drinking from about halfway. Don't just like tip it back and let them guzzle it in less than a minute. It's kind of
Mm,
overwhelming for them.
That's good to know because I feel like I feel like the fear is also that they inhale air and
They're gonna drink air. We all
yeah.
eat air when we're
Yeah.
eating.
Yeah, exactly. And so
Gotta
I
breathe.
totally. That's
Yeah.
true.
And there's a lot of bottles that promise less gassiness, and if you've tried it and it works for you as a parent, do it. Um, but it shouldn't be such a strong promise because some babies, they have to suck, swallow, and breathe at the same time. Just like if we were chugging a water bottle, it's like, well, you still have to breathe. So there is just going to be some air entering when a baby gets food.
Yeah,
That being
makes sense.
said, the volume at the breast, you can't overfeed a baby when you're breastfeeding them. But in a bottle, it's easy because they drink it so fast for them to kind of overeat or for you to feel like, wait, that only took 1 minute. My baby's still screaming. I'm just going to fill it up again. So be
Mm.
mindful of sharing that responsibility with your partner and let the baby go slow.
Do you
Um,
recommend any like specific apps or ways to track that as the baby gets
yeah,
older? And
yeah.
yeah, that's just
They
coming to
all
me.
work essentially the same way. Some people have favorites. I really like the simpler the better. You have a lot to remember as a parent. When's their pediatrician appointment? How many peas a day are they having? All of this stuff. Huckleberry is a favorite among parents. It's really simple to visualize. You can share it with your partner
Mm,
so you can both have the same child and track everything. You can be at work and you can be like, oh, my baby had a poop while we were at home. And this is what I'm
epic.
scrolling now instead of Instagram. So I like that app. If you put in diapering or feeding app. They essentially all track feedings, whether that's breast or bottle. They track diapers, sometimes quality of the feeds, behavior of the baby. You can get as complicated as you want, but I like to keep things simple for these families who are working so hard as it is, especially first time around. It's pretty overwhelming. The stuff and the information can be really a lot.
Yeah, it's starting to hit me because I just feel like it's closer to me these days, not just my clients, but my friends. I'm like watching them do it. I have like no judgment. It's just like a clean slate of observation. And I'm like, wow, yeah, there are a lot of things to consider for that baby, for that baby, for that baby, for that mom's
So
boob, for that
different,
mom's vagina. Like,
right?
it's a lot. It's a
No
lot.
two vulvas the same, no two parenting styles.
No, no, everyone's got their unique way. Ugh. I mean, yeah, it's just a really special journey. I feel very lucky, like we talked about the last time, to be able to witness a lot of them move through it
Hmm.
and just like watching the miracle of, wow, food is coming from your body. Like, I asked actually this couple, our friends, I was like, to the partner, hey, like the dad, have you tried the breast milk? Like, especially because of
Mhm.
the breast milk that was pumped and had allergens for the baby. And I was like, did you throw it
You're
away?
you're
And
not
sorry, going
lactose
back to the,
intolerant.
yeah,
Drink it.
exactly, exactly. I'm like, you're still eating dairy, right? So like add it to your coffee in the morning. Like, what are you doing with it? And he
Hmm.
actually hadn't had it yet. And I was like,
Did it give him the ick, or was he just like afraid
no.
to
It didn't give him the
do it?
ick. I think he was just like, I don't know, maybe that it's not his. It's not for
Oh, it's the
him. You know what I mean? It's
baby.
the babies,
Yeah.
which I appreciate. Baby needs their caloric intake, like you're saying. But yeah, I just thought that was so funny. It'd be like one of the first things I do though for
Oh my
myself. It's
gosh.
just
Of
like I
course
want to
I would.
try what this is because
Yeah.
actually
Have
it's
a friend give you a little, give you a little bit. Your friends would probably be open to it if they're friends with
oh
you. They
yeah,
know
my
you want to
friends
try it.
definitely maybe that friend for sure. Some others maybe not. But
Listeners, don't be afraid to come to a party with us. We're not that weird.
I will try it in my tea.
Yes. Little Earl
No,
Grey. Perfect.
exactly,
It's
exactly.
very sweet compared
Yeah,
to like store milk.
right.
And there isn't any danger in you trying it. You want to know the person. If you're married to the person, you're already exchanging, blood
Fluids.
products anyways,
Sure.
especially if you got pregnant. And there's no danger in them trying it. You're usually making antibodies for whatever your kiddo has come into contact with. So I think there was a point where one of my kids had a cold, and I was like, "You want some breast milk that's got antibodies for whatever this kid has?" And he
Oh
drank
my gosh.
it.
Epic. No, I
Yeah.
would
Poor
definitely
guy. Married
be.
to me, I'm like, you don't, this isn't a yes or no question.
No, there's no option
I've
actually.
spiked your coffee.
No, I love that. I think that's so special. And so, yeah, again, just like the magic of it. I remember going to Costa Rica last year and actually like learning to milk a cow. Um,
Cool.
And like
So cool.
my dad grew up on a sheep farm where, everyone's familiar with animals in Montana, right? I had never actually milked a cow before though, and I was like, I have a feeling I'm going to be good at this. And I was. And I milked the cow and I got to drink the milk, and it was the
So
sweetest,
fresh.
yummiest milk I've ever had.
Oh
And
my
it's just making
gosh.
me,
Should we all get a sheep? Should we get a sheep?
let's share a sheep or goat to
A
eat
joint
all of the
custody of a milk baby. All go together.
goat's milk. Yes. Yes. And goat's cheese, goat
How
cheese.
fresh. That was probably
Amazing.
delicious.
It was amazing.
Amazing.
It was amazing. Turning it around completely
Yeah,
because we
what are
have
we
like
talking about
20 minutes
next?
left. Um, I really want to talk about leveraging. Well, maybe it's not even about leveraging, but like honestly, the craziness going back to Working Moms, that show that we
Mhm.
alluded to in the last episode together, where the mom just had her second baby and she's separated from her husband, right? Just to give it away. And she's hooking up with her assistant, kind of, and he's younger or whatever. And he's like, there's a fetish around wanting to drink her breast milk.
Okay.
And they're like having sex, right? They're getting ready to have sex, and she's all of a sudden like making milk and it like explodes everywhere,
Does
essentially.
it show on the show? Like, did they have to
Yes.
get some kind of prosthetic leaking breast?
Uh, that's a good question. I actually don't
How did they do that? They have
remember.
to have a lactating actor?
No, I don't know. She might have been already
Probably
like
just a shot
actually
of him on his
pregnant.
back or something. I don't know.
I feel like I got a full visual of like the bedroom that they were in.
I'm gonna have to watch this again.
I'm
We're
gonna
gonna
find it.
hit this on the third
I'll let
episode.
you know what episode and what scene that is. I'll put
But
it in the
essentially, you're
show
saying
notes.
that during a state of arousal for her, she's ejecting milk.
Yes.
Okay. And the question behind this is, what do you
What's
want to know?
happening there? Just like what's happening there. And
Oh,
like,
okay.
yeah, I guess if there is like, I don't know, is this a taboo topic where like the partner, like let's just keep it simple for now, but like a heterosexual partner, the man is not wanting to drink the milk, like he finds it ick, or is it like, ooh, that would actually feel good as the mom, like,
Gosh.
please,
What
like,
hits the gas? What hits the brakes?
yeah,
To each their own. For some
right,
guys, it might be like, this is for my baby. And so I'm having a really parental reaction to seeing
yeah,
your milk. And that's not part of our bedroom affairs. This is separated by this. For some people, it might be like every juicy part of your pregnancy and lactation turns me on. Like you're so fertile and you're so plentiful with milk. So there's no really wrong way to think about it. I don't consider it, you know, the breasts are sexualized before you have kids, and then there's that period, and then maybe after, maybe during. So everybody's going to be different around that. What's happening physiologically is that the hormone involved in arousal and the release of oxytocin during orgasm can cause a letdown, which means that the muscles around the glands of the breast that store the milk are contracting. So you have these involuntary contractions during orgasm. You also have involuntary contractions in other places during an oxytocin release, including the muscles around the glands
hmm
of the breast. And so maybe when she was getting close, maybe when she was just feeling aroused, and also the physical shaking, jiggling, mobilization of the glands and the ducts kind of tell the body, like, we're going to feed, we're going to feed. And so
mm
maybe she wasn't even that aroused, but she was bouncing. It can just release that ejection reflex. And there's nerves in the breasts and on the sides of the mom's bod that when a baby comes to suckle, that's when that release kind of starts.
mm.
And during sex, just the same hormones are at play. And so that's often why, in fact, people recommend sex to initiate labor, is because if we get an oxytocin release, we can get some contractions, we can get the
hmm
labor going, and prostaglandins as well in the semen. But yeah, during sex, I think even more interesting a topic is how does she feel about it? Is she like spent her life being ashamed of her body fluids? Is she like, oh, sorry, or is she like, this is great, I'm loving this? And how do they play with it together? So I don't think it's not taboo for me because this is my world, but I bet it's feeling really taboo for some people who, body fluids don't make them that comfortable.
Right, right. So
And if
like,
you're good at milking a cow, I have to tell you that. it's really good to be able to milk yourself as a lactating person. And it's a lot of what I
Mm.
teach is how to get your milk out. So we
Ooh,
can circle back to the sheep thing later.
wait, no, I want you to talk about that a little bit because, part of Vaginal Alchemy, the course that I do with women, it's in the self-paced and it's in the live version, but we incorporate breast massage because
Mhm.
of that microcosmic orbit that happens
Yes.
through the front line and the back line of the body. And it's like, if you've never experienced an orgasm, like, have you been playing with your nipples or no?
Maybe not. Maybe not enough. I don't know. Or
That
does
could like
that hit your brakes? You know, everyone's so different.
right, right. Well, I mean, then this is like totally tangent topic, but like a mommy and daddy kink. Like,
Mhm.
and if your partner suckling at your boob reminds you of your baby and the
Maybe you used to like
neediness.
it, and then all of a sudden you're like, why is this hitting my brakes? I miss this. Like, I'm touched out. That can totally, I hear that a lot, that switch flips,
When they
at
like
least
it
temporarily.
before and then
Yeah. And then
okay,
they're
okay.
bothered by the fact that one, you could have decreased sensation, especially if you've had, breakdown of the tissue of the nipple.
Yeah,
Or it just the context changes. We know that arousal has so much to do with context.
everything.
And all of a sudden you've got this wet tongue on your nipple and you're like, oh my gosh, please stop. Um, so, each couple is different. Each couple is different, but it's certainly something that should be addressed during sex and sexuality after kids, for sure.
Yeah. I think even I'm glad we like named it right now because that is potentially a thing that they haven't even considered. And I mean, it's not to push off or, save you from any grief, right? As you yet again change and morph and release old identities and come back into a new identity and maybe reclaim it again at some point. It's just, yeah, it's part of the process. But I think, again, people don't think about it.
hmm And then they come to support group and they lean in and whisper to me about sex they're like, I know this isn't a breastfeeding question, but it
But
comes
it's
up all the
related.
time. It is. And when you're breastfeeding, your libido changes. A there's a hard chemical, there's the chemistry you can't argue with. So what you do with it, everyone's really different how they feel, but there is a chemical component to being able to keep a milk supply and being able to release milk and what that does to your cravings for sex.
Mm.
Um,
Yeah, I'm honestly really curious. I wish I had followed up with a couple of these clients that I saw pregnant and in like the later stages of pregnancy and them telling me like they wanted to have sex pretty much like right away after giving birth. And I'm like, great. Like it honestly, it's shown a light on me, like on how much I see women who just don't want to have sex for a very long time.
Mm.
And I wonder if like, oh, are they kind of the outlier there that really wanted to come back to sex with their partner after giving birth? And I don't know if I knew that they did that or not. Did they change their mind? Did they need more
Yeah.
time? Did they actually have sex like earlier? I don't know. I wish I knew.
Yeah, and each of those people is if you're feeling stressed in your new parenthood journey together, or if you're not, can also affect, does sex help you feel less stressed or is it stressful for you? Like when you are stressed, do you want sex? Or when you're stressed, do you not want sex? So
Yeah.
that's
I mean, I always also question, is
feels
it that
like a
you want
spirograph.
sex or don't want sex? Yeah. Or are you just not wanting the sex you've been offered or that he's currently
Yeah.
offering?
That's
Is
what
there
Emily
another
says, right?
version? Mm-hmm.
Saint
Mm-hmm.
Nagoski.
Exactly.
Like,
Come
are
as
you
you are.
wanting the sex that you're having?
Yeah.
Yeah.
Yeah. And if not, we could always ask for something different.
Yes, totally true. Maybe sex is a no nipples thing. Maybe it's an extra nipples thing. Who knows?
Yeah. Yeah,
But it's a
exactly.
really, when you do the alchemy stuff, which I really should just participate in so that I can learn more because wow. But
Come.
breastfeeding is a really hands-on experience, and I'm sure you experience this with people with their sexuality and anatomy. And there are people who just have never touched. They just
Oh, yeah.
aren't familiar with what each anatomical piece is called. Just massaging their own breast. It's the first time they've ever touched their own nipple. All that they've done is wear a bra, and so it's a real introduction to a really intimate moment where they're learning to stroke a thing they've never stroked to get the milk moving around. So a lot of what I teach is how much hands-on will help bring in a milk supply, help your baby latch, and help you have that letdown required to feed
Mm,
the baby. It's really good to be able to milk something and
yeah.
someone because that's how we feed people.
Yes. No, I'm having so many ideas, Lizzie. I can't wait to see you later in person.
Come to our clinic. Come to our
Yeah,
clinic where we have a sheep. We'll teach you how to hand express. Like, it's
I
not
love
funny,
it.
but in
No,
this,
no, no. But surely. Oh my gosh, I just had a thought and it escaped me again.
because we bounce around together, it's a good time.
I know, I know.
Is it about a sheep? It's about hand expressions, it's about alchemy, it's about
Yeah,
touching.
it was about the touching. Oh, I was just gonna say that there, like you said, there are many women who haven't touched themselves, and I feel like it was kind of mind blowing. I was talking to, let's just call her a friend, who I've known for 5 years, and we talk about a lot of things. She knows what do for a living and all that stuff. She's happy to share her story. She's got two older boys, and I was telling her about like breast massage, and I was like,
Mhm.
"Do you not?" And she's like, "No." I was like, "Even when you like put lotion on your body, like, do you put lotion on your body after you shower?" And she's like,
What
"Yeah."
about
And
your breast exam?
I was like, "You don't put lotion on your boobs? Like, come on now." And that's the easiest way to incorporate it, right?
Hmm.
Like maybe
Like, I'm
that
just
tissue
rubbing
doesn't
this
get dry,
in.
but yeah, exactly. You're just rubbing it in. It's all good. Oh my gosh. It's also one of those things where it's not available necessarily in the United States that I know of, but when I went to Bali and I did a massage with my mom and we're like side by side table, like couples massage, and they massage your boobs
Yeah,
and
get that lymph flowing. Your
it feels
armpit?
amazing.
So good.
Yeah.
And you can use it in different ways in lactation. So, massaging and erecting the nipples, compressing the breast, excreting a little bit of milk helps baby latch. And then in engorgement, you can massage a completely different way and get the swelling down when you're making, when you're having a fluid shift after delivery. You have all of this fluid in your body, and there's lymphatic, you know,
Drainage.
drainage. It's not as rough as lymphatic drainage in other contexts because you want to be really gentle not to wake up the milk and exacerbate the swelling.
Hmm.
But we can use it in different ways in waking up the breast, calming down the breast, depending on the direction and the pressure.
Okay, two questions. First question has to do with having breast cancer. Like if someone had breast cancer really young, maybe
Mhm.
they didn't get a mastectomy or anything, but they then got pregnant. Like what's the protocol with that? Um, and then I had another question about like implants
Is
and
it about the explants. ability or about
Yeah,
should
should
they?
should
Should
they?
they?
Like
Yeah.
because massage technically is contraindicated for anyone with cancer.
Mm.
Um, at least from what I was studying in PT school back in the day. So I'm like wondering, okay, we're talking about massage and touch. And I mean, I think touch is obviously, it can be different. Massage is very different, whether you're doing something really soft and flowy that's gentle for something like lymph
Mhm.
versus to help express your milk. But I guess that also, yeah, just I don't think I've ever encountered or thought about breast cancer and breastfeeding like coexisting.
Yeah, um I'll start with the should. The contraindication with breastfeeding and cancer that comes to mind first for me is what medications are we on? Are we completely in remission and this is something that's not a presently being treated condition? Um, Chemotherapies and certain um, immune suppressants, certain medications, even if they're stopped during pregnancy, there's things we don't want to take while we're pregnant that, chemo drugs are one of them, one of
Mm.
the medications we don't want to pass through to baby or breastfeed with. So there's that. What medications are you on? If you're doing chemo, definitely if you're doing radiation, you don't want to be close to your baby for that time of, that period of time where you're sort of leaking this toxic. It depends on the medication, is what I'm saying. Um, Things that have resolved, or lumpectomies that ended up being either benign or if they were cancerous, but we kind of got it all. I've seen people breastfeed with partial breast. I've seen people breastfeed with one breast. And then there's times where there's a surgery and it's kind of unknown what tissue was taken away. Maybe at the time you weren't thinking about like, oh, I really want to preserve my glands or ducts, but if the tumor's growing somewhere and they need to take it out, they might take everything they need to. So it depends on what is left behind. If there's ducts and glands and they're connected and they have a way to excrete milk, it's kind of a let's see what we can do. Maybe you'll make a half supply on that side. Maybe you'll make none on that side and a full supply on the other.
Mhm.
So lots of people with a history of breast cancer can breastfeed. It's really depending on the current treatment that you're undergoing.
Fair question or fair response.
The massage thing is really actually new to me. I don't know enough about massage being contraindicated. I know that, cellular movement, especially if it's growing and traveling,
Metastasized,
I
yeah.
could see that being an issue.
Yeah.
And
Oh,
um, I've seen people who've had double mastectomies voluntarily, give birth and still require some counseling as well.
yeah.
We talked about that funny situation where like you think you have all the breast tissues gone and then you've got something going on in your armpit and you're like, there's
Right.
something here that's making milk.
Right.
Um, so yeah.
Yeah. No, that's I'm glad you mentioned that again. Um, okay,
What
what
about
about
augmentations?
yeah, like with augmentation and or with an explant? Like what
Mhm.
considerations are we thinking about with that?
Yes. The date of the surgery and how long it's been from that surgery. We're considering the placement of the scar. So if you have areolar scars or if you're doing a reduction and you'll only really get this visually, for listeners who are just listening, at the crease of your breast, if you were to draw a line from your nipples down to the crease of your breast on both sides, in other words, an anchor scar where they kind of do an incision underneath the breast tissue and then travel up to the nipple. That's really common in reductions that can interfere with a lot of nerves. Areolar scars where they draw a circle around the areola, the darkened part, the dark pigmented part of the breast tissue where the nipple is in the center. That's an areolar scar. So the placement of the scar and how much scarring there is will affect the nerves. The nerves tell the body that the baby is there, stimulating, removing milk, and giving you that essentially the milk ejection reflex down the line. So scarring is a big consideration for augmentation. Scarring that doesn't include the nipple or the outside part of the breast, probably a better option if you're doing it laparoscopically through the armpit, through the belly button. But with reductions, oftentimes it's cutting right into the tissue. Under over the muscle, consider that under the muscle is great because you don't disturb the tissue there. And complications from the implant, did it take? Was there any kind of subsequent infection? And a question that we always ask too is nipple sensation. If your nipple sensation is intact and you have breast changes during pregnancy, that says to us, those breast changes are an indication that during pregnancy, your body already started that process. So with augmentations, reductions, biopsies, mastectomies, all of that is an experiment. How much will you make? I've seen people who've had someone the other day, they were on their ninth surgery. They've just had surgeries their whole life. And she made plenty of milk and it was excreted fine. Her baby breastfed great. And then I've seen people who have had never had a surgery and it's different for them. So it's experimental, but it is, I would call it a hurdle if you've had breast surgeries because you're opening, you're modifying, and you could get in the way of the process.
Mm, yeah, so much to consider, but very
Explants are probably going to depend on like where the ins and outs of that implant went. And if they're
right.
being explanted because there was a complication, encapsulation, scarring, things that caused the need for an explant other than just elective,
Yeah.
that's a consideration too.
Right. I'm like pausing because I'm thinking about a few clients that one has had had an explant before she got pregnant, I believe, and then is breastfeeding. And then one who I can't remember when she got her implants, but it might have been after she'd given birth. I'm having a hard time remembering, and then there are just so many other stories, but are the two that are like sticking out to me right now that I'm
They're
curious about.
common. Breast surgeries are
Oh,
common.
yeah, totally
And then
they
we
are.
can put these subjects together if you're ready.
Oh, do
I had
it.
somebody who had a breast augmentation, and even though she went through her belly button, um, so her scarring wasn't extensive or anything, but she had lacked nipple sensation after the surgery. She just couldn't really feel her nipples, and she had more success excreting milk, having that ejection reflex if she would first have an orgasm. So her pumping often involved if she wanted to get more milk from her pump session and she wanted her body to eject some, not just, the pump can suck, 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 but if you're not starting to eject milk, those two things have to go together. So she would, you know, masturbate and then be able to get better output at the pump, which became a task for her. So there you go. You're going to change your pumps and your accelerator and your brakes that way by being like,
Right.
I used to enjoy this, and now it's like
A task.
this is a task and it's a lot of work for me and I'm not having fun. So arousal and milk are very much related to pull the surgery part and the supply part and the pumping part together.
Oh my gosh. Thank you so much for taking something that feels so complicated and out there
It's
sometimes.
all
And
related though.
it
It's all
is.
related.
It is. Oh, we have, yeah, more to talk about. Part three coming up in, I don't even know when, but it'll happen. I
ASAP.
guarantee.
If you have the chance, listeners, milk something. Go to a farm, experience the process,
Get
find
yourself
out
a
what it
sheep.
get yourself down to the farm. Um, yeah.
Oh, I
Thanks for
love it.
having me today. Great questions. This we could just talk forever.
Of course. Thank you, listeners, for sending in those questions and
If
just
you're
starting
here,
to
you heard the full
stimulate
thing.
me. All right, you guys, we'll see you next time. Thanks for listening and for placing your finger on the pelvic pulse. I'm Brittany Ellers. The music for this podcast was created by Just Tech, and I'm grateful you're here breathing this conversation in with me. You're invited to stay connected by following the show on Apple, Spotify, YouTube, or wherever you listen, and by sharing it with someone you love. Beyond the podcast, there are 2 free spaces waiting for you: the Arousal Anatomy Adventure and my private podcast, The Pool of Presence, both designed to support you in coming back into your body and listening to what's real right now. You'll find everything linked in the show notes. Let your curiosity lead you and enter wherever you feel drawn. It's an honor to walk alongside you.